Okay, there should be a PowerPoint presentation up. Yeah? Okay. Let me go back here. All right. So the next illustration we're going to be doing is an educational illustration, and they're known as didactic illustrations. So the question comes up, what is a didactic illustration? Has anyone heard that term before? Anyone familiar with it? Right. It's just a fancy word for a series of illustrations that tells a story. And as medical illustrators, we spend a lot of time doing that. Tended to convey instructions, designed to teach. You've seen these all over the place when you get a new dishwasher and you look at how to install it, the step-by-steps, the stuff you get from IKEA, those are all didactic illustrations. So it simplifies a concept and it walks a person through each step. And that's what we're going to be doing is with a knee surgery. I had a couple other examples up here I wanted to show you. This piece is a medical legal piece. This is not mine, but it's showing kind of a timeline of this person gets in a wreck with the motorcycle and how they injured their thumb. They went over the handlebars and they had a groin laceration, tore the posterior cruciate ligament, which we're going to learn about today what that is. But again, it's just kind of a step-by-step that walks a person through what happened. This is another one, how to deal with a dislocated shoulder. A dental piece, just showing how to extract a tooth. I did this one in grad school, and I went and watched tooth extractions for a few hours and probably took like 100 reference photos just to do these 3 drawings. It was a little overkill. We'll talk about reference photos. This is a didactic, but it's a single panel didactic that it just kind of shows an enlargement of the spinal cord that's being operated on here. This actually did get finished. That was a pencil sketch that I did. I actually have the final. I hadn't finished at the time on that one. This is a beautiful piece. This one's not mine, of a heart surgery. Really like this piece. And there's just all kinds, setting up a drill bit, but you get the idea. Step by step on how to give an injection, more stereos. Again, this is an all inclusive, so it's like a single illustration, but it shows multiple steps within it. Same here, single page, but shows multiple steps. Single illustration that shows a breakdown of a bike. More technical breakdowns. This is my favorite one, absolutely ever, is the IKEA alien. But you kind of get the idea. Making baby smile. What I wanted to show you was, though, let's see, the piece that I'm working on right now. Oh, don't save that. Let's see. All right. Where are we at? All right. So I think I showed you a video a few weeks ago of a surgery that I'm doing where it's the urogenital reconstruction surgery. And what you're going to be doing is something very similar to what I am doing on that project. I went through, let me pull my Photoshop document up. Give me 1 second. When I start these, what I usually do first is like on this one, I went and I interviewed the surgeon, sat down and talked with him for about 45 minutes to figure out what he wanted in this piece, and talked with the writer about it. Oftentimes they will then send me like the text or something like that. They didn't have a text written up, but they sent me the videos So, and I'll just flip through these kind of quick here. I went through the videos. I'm still not through them. I still have like 12 more to watch. There's 116 of them. And they're like 5 minutes each. So it's been really irritating. But so I went through and I found like what I thought were important points of the surgery. And I just took a lot of screenshots as the surgery's happening. And this is pretty typical of how I will do a surgical piece. I've been invited into the operating room before, but really working from a video is probably about the easiest way to deal with a surgery because you can pause it, analyze it a little more in depth, and you can see. And when you're in the operating room, you know, the artist is like the last thing to be concerned about in the operating room, so it's often quite hard to see when you're in the OR. But anyhow, you get the idea. I can kind of flip through and just take a bunch of. This video is really, it's long, but it's really, really fascinating.
It probably helps having the surgeon tell you, like, to interview the surgeon.
It does, yeah, to know what they wanted, because really a lot of this previous part of this is a common surgery, and then like halfway through it changes to a new technique. So just those things. That's a really pretty piece right there. But anyhow, just trying to decide what to illustrate. So I take all these screenshots. I go through and I study the screenshots. And then the next thing I will do is, well, these are the notes from the meeting that I took with the surgeon. And then I will go through, and after I watch the video, I'll sit down and I'll kind of write out step by step what I kind of felt, what are the important points of the surgery. And then after I'm not even done yet, but after I get a certain amount of, after I get the steps written out, then I will go through and I will start sketching and try to kind of get some ideas behind those steps that I identified and start thinking about how I could lay this out as an actual illustration. I'm going to have a 2-page spread in the magazine with very little type. It's really picture heavy, so I have a lot of space, but how do I best show this? And I haven't decided that yet. I don't know. I don't know yet. So this is my working process. I thought I will work on this when you guys are going to work on the knee surgery. We'll kind of do them together. You can kind of watch my process as we go. But so I went from drawing like, I went from like up here of trying to like draw pretty true to the actual screenshot from the surgery to over here. These are more conceptual ideas of, they're not from the surgery, but they're more anatomic conceptual pieces showing what the idea is behind it. And what I think I'm going to do on this piece right now is I think I'm going to have several really very realistic images in there, maybe like 3 from different steps. And then I think I'm going to have some of these smaller like conceptual pieces that are like almost like diagrams that kind of break it down in a much more simplified way. So I don't know exactly where I'm going with it yet, but this is the process that I will use. And then you can take some of these sketches and start, you know, blowing them up and seeing how things fit on a page. But that is kind of the process that I use. The project that we are going to be working on next, let me see if I can find it. 1 second. There we go. Got it. So on Go Studio, let's see where you're at. On Go Studio, if you scroll down, I've opened this project up just a little while ago. Project 4, the didactic knee surgery. There is right here a PDF, Project 4 didactic knee surgery. That's what I'm going to go over right now. There's documents in here that you can read. There's a bunch of knee surgery and knee reference images. We're going to talk about drawing hands and drawing medical instruments. We'll do that next class, I believe. But there's just, and then there's video reference. And if you go to this sheet, you'll see that you're going to be doing 2 final illustrations for this piece. One is going to be an anterior-lateral view of a knee, meaning a front side, so like a 3/4 view. So you're showing some of the front, some of the side. Or you could do 2 images showing one as a front view or one as a side view of the knee, or you can combine them together. And so the first thing is going to be a study of the knee and just learning what all the anatomy is and getting everything labeled. The second step you're going to do is you're going to watch this knee surgery video right here, not the osteoarthritis. You can watch that too. It's kind of a good overview of the anatomy of the knee. But this knee surgery, it's a knee replacement. So you're going to go through and you're going to watch that. You're going to take a bunch of screenshots, find things that you think are important in that surgery, and you're going to do how many did I put down here? 4 to 6, 4 to 8. Well, 4 to 6 steps. So you're going to sketch out 4 to 6 steps that you think should be used to teach somebody about this operation, and you're only going to illustrate one of them though. So you're going to finally, for your final, you're going to do an anatomical drawing of the knee, and then you're going to do one piece from your surgery. Does that make sense? Anybody not get that? Okay. So while you're going to watch the surgery and you're going to figure out 4 to 6 steps, you only have to do a final illustration on one of those, because it could take a long time to do 6 illustrations. We'll find out. I'll time myself. See how long it takes. I think that's where I wanted to go for that. So there is also on, let me get out of there, the Go Studio page. If you go to the top, I updated the schedule again, and it's nothing major. It's just on this particular project, I moved a couple of due dates a little bit later. But so whatever schedule you're working off of, just throw it away and go to this newest one. I just pushed some dates back a little bit within that project. So no major changes. But what I wanted to do next is kind of a fun thing. And we're going to talk about how do you teach something. So it's the idea that you have to do as an illustrator is not just telling a story, but telling a story in the proper order. And we're going to practice that right now. So I'm going to need, let me stop sharing this. I'm going to need your microphones on, because you're going to have to help me here for a second. As soon as I find my other camera. Okay, there's my lunch camera. All right. So what we are going to do, and what you guys are going to also do on your own, is I have all the fixings here for a peanut butter and jelly sandwich. Okay, I love doing this in the classroom. I've never done it online like this, so we'll test it out. But I've got some utensils, some napkins, peanut butter jelly. I've got some bread. I've got a cutting board. And what you guys are going to do is you're going to tell me how to make a peanut butter and jelly sandwich. And I'm going to follow your direction to the letter. All right. So does anybody want to start? What's the first thing I need to do if I'm going to make a peanut butter and jelly sandwich?
Open up the bread bag and grab 2 pieces of bread.
Open up the bread bag and grab 2 pieces of the bread. That's the most efficient way. I can't get the bread bag open.
You gotta use the twist tie and untwist the twist tie that's secured on the end of the bag.
All right, I'm gonna do exactly what you can. So I gotta find a new bag. Okay, so
I didn't realize we were doing that.
Keep going.
That was much easier. All right. How many pieces?
2 slices.
2 slices. 2 slices of bread. Okay. Am I done with the bread then? Probably.
Yeah.
All right. Okay, so 2 slices of bread.
And
Now what do I do?
And then
Anyway.
you separate the 2. So that way you can
Alright.
work on one of them.
Work on one at a time, okay?
You grab your knife. And you, first, you should probably open up your jar of peanut butter.
Open the jar of peanut butter.
Yeah. I was like, wait a minute, we're doing.
Or sunflower butter for some people.
Yeah.
It's like, it seems stuck.
Oh my god. Twist the lid.
Oh,
It's
twist
makes me think of that. Makes me think of the SpongeBob episode.
This is organic creamy peanut butter spread. Yeah. There you go.
Firmly grasp it.
Firmly grasp it and turn it. Hey, look at that! It opened. So, I'm from Mars. I've never eaten a peanut butter and jelly sandwich before. I have no idea what to do next. So, okay, so there is our peanut butter. There it is. Okay. Somebody else. Olivia's done all the work herself, all the heavy lifting.
You're gonna have to dunk the knife down into the peanut butter, the end that you're gonna spread with, not the end that you hold on to. The point of your part. Dunk.
You're good. Okay, like that. Got it.
Yeah,
Okay.
good. Just get a little bit out at a time. You don't want to get too much, make a mess. Yeah, there you go.
All right.
This
And then you bring it over to one slice of bread
All
and
right.
spread it on the slice.
This is
Right
exactly how I imagine we're trying to show aliens how, like, to make a sandwich to try different cultures' food.
Exactly. Is that enough peanut butter, or what should I do now?
Oh, there should be more.
That doesn't look like enough peanut butter to me. A little nakedness down there on the bottom of the bread.
More?
That looks good.
That looks
Real
good.
good.
So in class, this is fun because then we all get to have lunch together. So that's kind
I couldn't.
of. Okay, so there's my peanut butter. What next?
It's jelly out.
Get the jelly out?
Yeah. Use the other knife because that one is tainted now.
Got to open. Twist that jelly jar open.
Open it the same way. Got it. Okay. So I got another knife. Got the jelly.
And you scoop the jelly.
Smuckers. Now what?
Scoop it out with the knife that you did with the peanut butter.
So where am I going to put it? So if I scoop some out, it's pretty runny.
On the other
bread.
bread.
On the
that
other
does
bread?
that does not have any peanut butter on it.
Okay, so on this bread. All right.
Yes.
And I can put more on, right?
Yeah.
Yeah.
As much as you want.
As much as I want. Oh man, I love strawberry jelly, so let's go crazy.
For me, it would just be jelly.
Why ruin it with peanut butter? Got it.
I can't
Okay.
really have the peanut butter, to be honest.
Is that good?
Yeah.
Okay. Now what?
You will put the 2 pieces of bread together with the peanut butter and jelly facing each other.
Oh, good. You caught me. I was. All right. So close them up, huh?
Yeah.
All right. There we go. Now what?
Consume it.
Consume
I'd
it.
cut it diagonally. I can't eat a sandwich like that. I'd have to cut it diagonally.
Oh,
Okay. So I heard eat it and I heard cut it. What should I do?
well, let's cut it. Some
Okay.
people like it cut. And if you're
Can
going to go this far, why not cut the crust off?
Cut the crust off.
Yeah.
All right. So cut the crust off. You
I
got
don't
it.
usually do that for any sandwich, by the way. Just
That's what my kids like. I mean, they're 13 now. They don't eat that too much, but
any sandwich I make, I exclusively need the crust.
crust gets removed. All right.
I'm so sorry I've done this.
All right, so there, and I removed the crust. Is that good?
You could probably cut it diagonally now with the same knife.
Yep.
Cut it diagonally?
Yeah.
All right. Why does peanut butter have to be cut diagonally? It does. I mean, I know it does, but
The pointy corners, they're more satisfying to eat. I don't know why.
Okay, anything else?
The sandwich in general being cut
It's ready.
in half.
Pretty good?
It's ready.
All right.
That's the greatest thing I've heard.
Oh my
Good,
god,
really
that's so
ominous.
good. I'm gonna turn back the camera. You guys did great with that. Hold on, let me turn back here. Mhm.
I knew what route we were gonna head down as soon as you started. Like,
You did, yeah.
I was like, oh no, it's one of these.
One of these. My dog is up here at the desk now. He wants the peanut butter. All right. Watch this. Watch this. Ready? High five. High five. Come on, high five. There you go. All right.
You know,
Mm.
birds are supposed to eat fruit and things, but my bird Smokey seems terrified of fruit, but when I'm eating a burger, he sure seems to want it.
Your bird does?
Yeah.
There you go. Smart bird.
He's not allowed to have burgers. He's fat enough.
They're not?
Oh, he just got offended by me saying that. He gave me a look.
So what you guys are gonna do is you are going to, between now and I think next class, let me check the schedule, the updated schedule. Oh, come on, where you at? There it is. Surgical. Yes, today's the 16th. So for Thursday, I want you to teach somebody how to make a peanut butter and jelly sandwich. And I want you to do sketches, whatever you need, take photo reference. Photo reference is usually the easiest way to go with that. And then I want you to, let's see how many steps. I think I want you to do in 4 to 8 steps. Let me check the
Does it have to be a peanut butter and jelly sandwich?
What's that?
Does it have to be a peanut butter and jelly sandwich?
Does it have, if you don't have peanut butter and jelly, teach him to make something else. It doesn't,
I don't
some kind of sandwich.
Chip sandwich. I always have chip sandwiches.
Chip, whatever, any kind of sandwich. Peanut butter and jelly, I just always do because so many people like peanut butter and jelly.
I can have peanut butter.
You can't eat peanut butter?
Nope.
I'm trying to think if I have it down here, how many pieces to do. So anyhow, let's do, I didn't write it down, if I wrote it down there. Okay, so do 4 to, here we go. I wrote it here, 6 to 8 steps. So take 6 to 8 steps, and they don't have to be finished illustrations, just your sketches, but clean enough that we can see the process. And anybody here animation majors?
I am.
One? Okay, Raven. Anybody here taking an animation course?
I am.
Okay, a few people. You've done storyboards, right?
Yep.
Anybody not heard of a storyboard?
Yeah.
A storyboard, if you haven't heard, I'm sure you've all heard, you're in art school for crying out loud. A storyboard is a series of little drawings that give the progression of something. And usually they are, at this early stage, they're what are called keyframes. And a keyframe is like a transition. It's when something important happens. So as the animator, you would do this important point, this important point, this important point, and the lesser known animators would fill in all in between. What I want is 6 to 8 steps of making a peanut butter and jelly sandwich, or a ham sandwich, whatever kind of sandwich you want to make. And those can just be sketches, but they need to be clean enough that we can see what you're doing. And we'll look at those in class on Thursday. Okay, so that's where we're going to start with this. And I wanted to show you, let's see, a couple things. First, I wanted to show you this program called Radiant Viewer. Let me get this, save it. I sent a link out earlier to people to download this. To download this file, this program called Radiant Viewer, and this is used for viewing CTs and MRIs and even X-rays. And then on the project sheet, I believe it is, or in the Ghost, it's on Ghost Studios where it's at. It's probably on the project sheet too. On Ghost Studio, if I find it again. Whoopsie, am I still sharing my, I'm not sharing my window anymore, so that's why that's not working. Okay, just, right. Too many things to remember at one time. All right. Here we go. This is Radiant Viewer. And on the Ghost Studio page, if I can find that again. We scroll down here, you will find a link to DICOM knee files, DICOM infant head, and DICOM head and neck. And a DICOM is a file type. It's, I don't even remember what it stands for, but it's some kind of medical imaging is what the DICOM stands for, but I can't remember off the top of my head what it is. But all you need to know is that it's CTs and MRIs. So if you go to, let's open the infant head is a kind of a neat one. We'll play with that one. So if you go here to the Google Drive and it says coronal, you need to download that entire file. If you go into it, you'll see all these little files. You can't use any one of them by themselves. You need to download that entire folder. And this is obviously a coronal cut. So download that whole thing. Then we're going to open up this program called Radiant Viewer. And you can literally take the file. Let me find it again. Quick access, where are you? All right, we'll do it the hard way. All right, so if you have this right here is coronal, that's all those images in that folder. If I just take that and I just lay it on there, it'll open that folder up. So all I have to do is dump it on there. If I go to, where's my knee at? Well, I'll show you this one first. Oh, there's the knee. I think did I show you the knee before? Have you guys seen the knee that we made a 3D model of it? Did we do that early on?
Yeah.
Yeah.
It was like
this
when
is
we went for the broken knee.
Yeah. Okay. So this is that program, but this one, if we go through here, let's see where we're at. We can scroll through these images, and it looks like we are going from the front of the face back in a coronal cut. So there you can see the sinuses coming at us, and then the eyes, and the sinuses, brain. You'll see this thing right here that's moving, this white thing. It's a tube that's going like this, and we're catching pieces of that tube. I'll show you. We'll do a 3D image here in a second. Let's keep on going. And then we'll come out the back of the head. Nope, I went the wrong way. Then we'll come out the back of the head. So you get the idea. What you can do with this, though, is if you go up here to the top where it says 3D, and you click on this, this will give you a, it'll take all those images and put them together and give you a 3D model. And then what you can do is, come on. There we go. Is you can enlarge it. You can use these panning tools right here, 3D rotate. You can spin around. The problem is most of the time when you get medical imaging, it's usually like healthy people, they're very rarely imaged. You know, it's expensive. And so this was an infant that had, I don't even know what the brain condition was. I got this from a friend of mine who was building a 3D model off of it. But so there we can see the skull. And you can see where the sutures in the infant skull have not completely formed yet, and they would be a protective membrane here over this gap called the fontanelle. It's that soft spot on the baby. You cannot actually poke through the soft spot on a baby. It's a real nice piece of protection there. We can go at it from the bottom. It's kind of cool. But what I think is really neat to do, and I used this on some posters that I was working on, because I needed to draw the sinuses inside a skull that was turned at an angle about like this. And that's really tricky to do. If I go to the 3D presets, I was able to choose airway. And what this does is it filters out different densities of material. So it gets rid of anything that's bone. So this picks up skin. We can move this around a little bit and rotate it. And you can see the silhouette of the baby. You can see the shunt that's going through their head. Here you can see the inner ear, the eustachian tube. Let's see. Here's the sinuses. You can also take this tool. There's a scalpel here, and you can select an area. And you can say, cut the outside. Oops, I didn't want to do it the other way. Let's try again. Never remember which one I want. Cut inside. And I can get rid of part of the imaging, and then I can look around on the inside. But we could turn this back to, how about that? Oh, look at that. All right. How cool is that? Come on. You can see the blood supply in there. So anyhow, there's just all kind of cool things to look at and ways to play with this. And there's that shunt. It's kind of neat. But we can come up here and find the knee. There's one called DICOM knee, and if I drop it on here, I'm going to make a liar out of him. Right, here's the knee. So the knee is included in there for you as well. And again, this goes through. This goes through multiple directions. You can go like through a coronal view. You can do a transverse from top to bottom. But you can also do the 3D, where you can build out a 3D knee in here. And again, this is not a healthy knee. I mean, the top is, bottom's certainly not. But it is a great way to be able to observe it a little closer and to be able to move it around and interact with what you're drawing. So if I were going to draw a 3/4 view of this knee for this project, I might start out with this right here. And then I might actually, what I would do, come up here with the scalpel tool. Just get rid of this piece of hardware. No, wrong one. No, I was guessing wrong. There we go. and cut that hardware out of there. And now I can just turn it sideways and get a nice side view of that. The femur and the, what's left of the knee. There it is. So anyhow, if I were going to do a 3/4 view of something, I would do something like this. I would probably find a 3D image, and I would start with this. It is always, and we'll talk about this when we get into the hands, it is always going to be better to work from some type of photorealistic reference than to just work from your imagination. It just is. And even so, this would need cleaned up quite a bit. I mean, it's not a perfect scan. You can see the striping in there, and the knee's broken. So you have to work around with it. Sorry, I would just sit and fiddle with these all day. This is kind of cool. All right, so this is some of the reference that you have for this project. You have the video of the knee surgery. It's a knee replacement. It's kind of a cool video. It's only, I want to say 15 or 20 minutes long. It's been edited highly to give you the important points, so you're not sitting like mine. Like sometimes there's a 5 or 6 minute window in the one I'm viewing where nothing happens because the surgeons are standing around talking, but there's no volume, so you don't know that. You just got to kind of pan through it. But there's great voiceover explaining what they're doing, and it's only the highlights of the piece. So that's Radiant Viewer. And let's see, what else did I want to do? Okay, questions on that project as it stands right now? Nada? Okay. So we are going to look at the anatomy of the knee just a little bit. There's a ton of reference. Let me spelled that wrong. It says Ned Anatomy. That's really smart. Okay. Let's do a share the screen again. Okay, we're going to do a knee draw along to identify some of this anatomy that you're going to be working with. Okay. Oh, let's see. I went ahead and put the main anatomy of the leg in here. Feel free to screenshot this if you want, and to start with that, or pull up one of your previous skeletons that you drew and start with that as the base. And we're going to talk about the knee. One thing that I wanted to point out while we're in here, though, is that the head of the femur, if you'll notice in this little sketch here, the head of the femur should line up right over top of the patella, which will line up fairly straight over the calcaneus, right, to give you good balance. You'll see in the osteoarthritis video that you'll see a knee that's out of alignment and what kind of damage it does when the knee is out of alignment. But that's just something to look for, is that alignment in your anatomical model. You're not going to draw quite that far. But let's see, what I want to do is take this. I'm going to copy just this section right here. Oopsie. And there's the blank I'm going to start with. So take that skeleton that I did, or one that you've done, and just kind of get a close-up, a zoom in on the knee then. There's a bit of a cheat sheet up here on the right showing you the all the labeling that we're going to need to do for this. So the first thing we're going to do is we're just going to clean this little sketch. You know, it got a little gnarly. We're going to clean. It's hard to get tight when you're down there. We're going to clean it up and make it a little bit bigger. Flush the shape out just a little bit more. So what is that large bone, the top one that we just drew? This one right here.
Femur.
Femur. Yeah. Okay. And we're going to go down here and get the larger bone. I don't know how I want to do that. We're going to get this other large bone in the leg. And which one is this?
The tibia.
You got it, the tibia. Don't be shy. Scream them out. What tibia? That's our tibia. And then we're going to put this small bone in here off to the side. This one is the
Fibula.
fibula. Don't even hang. It's a fibula. And that where it was drawn over here is kind of too low. So I'm gonna raise it up here. It kind of sucked right in there. You'll see on that DICOM image, it kind of just nestles right in there against the tibia. All right, so we'll put the fibula in there. Okay. Then we're going to start adding in some of the softer structures. So we've talked about this the skeletal system and the muscular system, but we haven't quite talked about how these things are connected. And you can't have bone rubbing on bone. That's what you get osteoarthritis. It gets this like calcified state. It's very painful. So you have this protective cartilage called articular cartilage that kind of grows over the end of the bones. And this is just a smooth, almost slippery material, and it's well lubricated by in the synovial fluid, the synovial cavity, which is, we'll talk about it more, but it's an envelope that kind of encloses the knee and it's filled with a fluid. So that is the articular cartilage. You guys have it tough because when I started doing this, I learned all the anatomy first without worrying about drawing it. You guys have to like learn the anatomy and draw it at the same time. I think it's kind of challenging. And then there's a cartilage down here that covers the top of this bone. And this is actually called your meniscus, and it's a disc that, so the bone doesn't rub on the bone. So it's a thin disc that covers the whole surface. Anyone ever torn a meniscus? It's a common injury for sports, for runners, is where just like in my particular case, that this piece right here from the knee twisting, that piece got ripped off, and then it's flapping around in there, and they got to go in and cut it out, actually, and it's very uncomfortable. But so this can get ripped up if you're not careful. Okay. So that is the meniscus.
Kind of makes me wonder, because I used to.
What's that?
Oh, sorry. I was thinking because it kind of made me wonder, because like I used to work out all the time, and then like I noticed like sometimes there would be like weak points in my knee where like it would randomly like, hurt really bad if I stepped on it wrong. But it made me kind of think about that.
Yeah. Is it like catch? Can you feel it click at anything?
I don't know. Yeah, like it's kind of, but like it hurts sometimes. So unless I like step on it wrong, but that was like
You might have a
I just never
you might have a
dealt with
small
it, so-
tear. People can, I mean, you can live with them for years unless it's a bad tear, but you might have a tear. Not fun. Okay, so now we have to have a way. We have to connect the two bones together, because right now they're just kind of sitting on each other. But if you get hit, they're gonna fly apart. So we have a series of ligaments that are going to hold this together. And let's start with, you have one over here on the side. I'm going to come down here first. You have one over here on the side, and it attaches to this point right here. You have this bump right here and this bump right here are called the lateral and the medial condyles. C-O-N-D-Y-L-E. And this would be the lateral side. This would be the medial side. This bump right here is called an epicondyle. It's above. So this ligament attaches to the epicondyle, and it comes down here, and it attaches to the fibula. You can kind of get the idea there. And this dude right here is called your lateral collateral ligament, which is a long name. Lateral, it's right here, collateral ligament. So if we have a lateral, we're going to have a medial. And the medial collateral ligament is obviously going to be on the other side. And it attaches to the epicondyle up here. And it actually comes around and connects down here to the tibia. So now we've got some ligament and we've stabilized our joint left and right. The other direction we need to be able to stabilize this joint is front and back, right? And you have two ligaments. You have an anterior cruciate ligament called the ACL, which you've probably heard of. Athletes are always tearing their ACLs, and the posterior cruciate ligament, the PCL. And I tore my left knee is a terrible, terrible dumping ground now. I tore my ACL. It's very painful. Has anybody ever tore their ACL?
My dog.
None of you guys. It's I was playing rugby and my foot stuck in the mud, and the person I was holding on to dove this way, so that my lower leg stayed there and the rest of me went that way, and it ripped this ACL in half. The anterior cruciate ligament, it comes from up in this bone, up in the femur, and it comes down at an angle and connects down to the tibia. And this helps to keep your bone from sliding off either direction. Right? You also have another one called the posterior cruciate ligament that goes the other direction, and it starts here in the back and it comes towards the front. So they kind of do a similar thing, just slightly different angles. So between these two, you can't slip forward or backward, and between the two side pieces, you can't really rock the knee too much this way or slip it left and right. So now your knee is pretty well secure. And this, of course, right here would the condyle. This would actually come down and ride right on the meniscus. There wouldn't be that gap there. There'd be a fluid gap, but it would be very, very minuscule. So this would actually ride right down here on this surface. They would actually touch each other. And then the other thing we want to put in here is we want to put in the patella, which is the kneecap. What kind of bone is it? Do you remember the shape?
Yeah, is it the?
Starts with an S.
It's like the square.
Like a sesame seed. It's a sesamoid bone. Okay, so this is the patella. And so we'll put in the patella. We also need to put in this other piece down here on the tibia. I remember I said anytime there's bumps, the bumps on bones are for a reason. You have this tibial tubercle. It's a bump. If you feel the front of your leg, you can probably feel it. And this is where the ligament that holds the patella in place is going to kind of float. Let me get another layer here. So we have coming off of, what color to do this? Let's see. We have coming off of the patella, you have this connective tissue that connects it down here to the tibial tubercle. And if you remember, the kneecap just kind of floats inside of there. Right. Ligaments, if you remember, ligament connects bone to bone. Which is what we have here. We have a patella connected to this tubercle. Whereas a tendon connects muscle to bone, which is what we're going to have up here. So we have the patellar ligament. And then up above, we're going to have the quadriceps tendon. And the quadriceps tendon is going to come off the patella and it's going to open up into your quadriceps, which is Trey's favorite muscle today.
I'll never forget it.
Never again. Let's see. So this is all going to be the connective tissue. Ooh, a little leggy today. All right. So you get the idea. This is is a quadriceps tendon. Okay, so that's kind of a very basic anatomy of the knee. One other thing that you do have is this won't matter for this illustration, but for a joint this complex, you have this synovial membrane that not exactly I think it connects kind of like this, and it makes this pocket around it, and then I put that on a layer, didn't I? Okay, and then all this is filled with synovial fluid, and that fluid is what lubricates that joint. So you have a pocket in there, but you won't need that for this. You won't really need that for this illustration. So that is the basic anatomy of the knee, and in your first anatomical drawing, it's going to actually be something like this. It could be straight on and then also a side view, or it could be 3/4 view showing the front and the side at the same time. And I think most of what we labeled today over here is what you're going to need to label for that illustration. And it's also, the surgeon is going to refer to a lot of these terms as you're viewing that surgery. So make sure that I keep this drawing out there while you're watching the surgery so you can quickly reference back to what the surgeon is talking about.